Alright, so let us begin with Alan's keynote study streak. It is session number 55, and we have been doing this session since 11th of June, and now I have spaced it out because of different workshops that I have started conducting, especially the fever workshop which is going on right now. Two sessions of fever workshop have already been done, and if you are missing out on registering how to treat fevers, how to give medicines, homeopathic medicines in fevers, you should learn to develop this technique. So let us continue with Alan's keynote study streak from Alan's keynotes, and the remedy today we'll discuss is a continuation of the remedy which we have studied in the last few days. Last we took up was Sabardilla and Eupatorium, and a bit about Euphrasia was covered in the last week. So an extension of the similar pattern of complaints we will find in rumex crispus. Now some remedies you should know them so by heart that they will become useful for your clinical homeopathic practice very easily, and the quickness of your prescription will depend on the first few observations and first few lines told by the patient. For rumex in Allen's keynotes we have, for the tubercular diathesis, extremely sensitive skin and mucous membrane. That's it. Even if you remember these two lines, they are going to suffice for you to prescribe. When it is sensitive, it means something which is sensitive for a patient or a remedy. But when it is extremely sensitive, it means that this is the highest degree of sensitivity expressed by the remedy and the patient. You have similar extreme sensitiveness in hepar sulf, but this remedy which is rumex goes beyond hepar sulf. So if I were to lay down a chart of remedies with sensitivity to air, especially exposing themselves to air, I would say that it starts with aconite, belladonna, hepar sulf, somewhere baryta and rustox also along with hepar sulf, and then it will be the extreme sensitiveness which is the right hand side corner, which will be rumex crispus with sorainum. So sorainum and rumex would be rated as two of the top extremely sensitive remedies from the current study that we are doing. So next line what you read is again similar, which is extremely sensitive to open air, hoarseness, worse evenings after exposure to cold, and voice uncertain. So someone who will come to you with a kerchief on their face, handkerchief. There was a patient who told me that lockdown period was a blessing to him. This was the first time someone coming and telling me the opposite. Otherwise all the patients have been telling pre-lockdown and post-lockdown stories. Before lockdown I was so and so, after lockdown, after COVID period I have been unhealthy, I have this problem, this that problem, etc, etc, etc. But one patient came and told me that he was feeling so relieved in corona period, in COVID-19, and he was kind of sharing his experience like a extreme joy that he had. I asked him what was it that made you so happy in COVID-19 period, because everyone on earth was suffering like so bad. And he told me that we had to all wear masks, and I am having this problem of recurrent cold and cough, and wearing this mask prevented everyone to sneeze outside, cough outside in the open air. There was less contamination, and I could kind of feel so good and breathe fresh air, even though if it was from the mask. So now after the lockdown, after one and a half 2 years, second third wave, everyone discarded the mask and everyone is back to square one. I am the only one who is wearing mask all the places. That's where I chose to give him rumex Christmas. Someone who will enter with a handkerchief on their face, someone who will watch not you but the fan or the air conditioning about what the temperature is and how he will cope up with it. That is his extreme sensitiveness. And then he will sit down at a place where there will be least air exposure happening to him. And even if it happens to him, he will start having some symptoms. It can either be nasal discharge, it can be sneezing, or it will even be itching. Rumex has tickling in the throat pit, which causes dry teasing cough. I have explained this previously in some of the previous sessions also about the tickling feeling, and the remedy which has this similar tickle is hyoscyamus, very strong, but in hyoscyamus it is a dry cough. There will be kind of an itching and dry cough. And conayam also has a similar pattern, but conayam will always want to sit up when there is a cough bout. Rumex will cover up, conayam will sit, he has to sit up must. That is the rubric in Kent repertory that you will find. And in hyoscyamus, as soon as they lie down, which is similar to Drosera, but hyoscyamus will tell you that any time during the day, even if I lie down, I will have a lot of itching in the throat and cough. And the itching persists in spite of the cough which keeps on going, the itching persists in hyoscyamus. And it will be a short and hacking cough which goes on persistently after few minutes. Drosera will tell you that there is something stuck up in the throat. I feel that there is kind of a choking feeling, something is stuck up. And at night the cough bout starts and for 2 to 3 hours it goes on. Whereas in hyoscyamus it will be itching in the throat which is persistently there and a dry kind of cough. In rumex you will find similar itching, but rumex will be more sensitive towards air and you will get the confirmation from the patient itself, whether it is from the external air wherever he goes, whether he rides a two-wheeler, four-wheeler, changes the place from warm room to cold room or cold atmosphere to warm room or vice versa. And next what you read in Allen's keynotes is that there is dry, incessant, fatiguing cough, worse from changing air or room. Similar presentation we also see in the remedies phosphorus and sanguinaria and spongia. Sanguinaria I have given to few patients where there were gastric symptoms with it. And phosphorus and spongia will have a similar presentation of changing air from cold to warm or warm to cold, vice versa. And in the evening after lying down will be aggravation for rumex. And as soon as someone is touching or even if they put their cloth over here, it starts the cough. Lying on left side aggravates rumex. And slight inhalation of cold air, which I have always been sharing since the beginning of this session. And he covers himself with bed clothes to make himself warmer. And last but not the least line that you should all remember for rumex is mentioned in Allen's keynotes is little or no expectoration. So you go in the Kent repertory, you go in whichever repertory you wish to refer, check all the rubrics of expectoration and check whether rumex is present. You will find barely a few rubrics. Whereas on the contrary, if you see the same presentation for Kali bichromicum, Hepar sulf, you will have so many rubrics and descriptions. So that is your way to differentiate. And how will you reach rumex is by extreme sensitiveness, dry cough, itching in the throat, and no expectoration or very little expectoration. Coccus cacti, on the contrary, has similar sensitivity but profuse expectoration, especially in the morning. Again, profuse expectoration, especially in the morning, with a lot of gagging cough, also aggravated by air, Sina. Very few homeopaths prescribe Sina for cough symptoms. In the morning, if you have a patient with cough symptoms describing similar gagging and a lot of expectoration, think of Sina also. In rumex, what we read further is that the cough is aggravated by cool air or anything which increases the volume or rapidity of the inspired air. So it needs to be in exact quantity for him. Sensation of lump in the throat. We saw this also in rumex, in Drosera. We will see this also in various other remedies, but here it is there in a mild degree. The sensitivity is more than the lump sensation. Whereas in Drosera, it is the lump sensation which is very important, very strongly present. And here the lump sensation descends on swallowing but returns immediately. There it remains throughout in Drosera. Over here you see there is raw sensation in larynx and trachea when coughing. We have a similar presentation in causticum. Causticum will also present you similarly, but he will not be able to bring the cough out. It will come till the throat and it will slip back. That is the partial paralysis of causticum. And in rumex, you will also have urine which is involuntary with the cough. We have another remedy which is causticum, pulsatile and silica, matching exactly what this is seen in rumex. There is involuntary urination with the cough. Very few homeopaths prescribe rumex for diarrhea and skin symptoms. But in Allen you will find 3 lines each for these descriptions, and they are worthy of noting that there is early morning diarrhea from 5 to 10 am like aloes, natrum sulph, podophyllum, sulfur, and the stools are painless, profuse, offensive, and there is sudden urging as if he has to drive from his bed to the toilet seat. This is exactly what we see in rumex, sulfur also, aloes socotina also. Next is about the skin symptoms, and for the skin we have itching of the various parts aggravated by cold, better by warmth. So the common modalities of rumex, which is aggravated by cold, runs through and through. Better by warmth feeling runs through and through. When he is undressing, uncovering, exposing to cold air. So you can think of this remedy if there are very less eruptions or no eruptions, but there is extreme itching as soon as they are changing their clothes, and it is on the exposed surfaces. On the covered surfaces you can think of the remedies Miserium, which is again another extreme sensitive remedy, but it has aggravation at night and aggravation from cold air. In rumex we also have similar presentation, but it will be with or without eruption, mostly without eruptions. So we come to an end of modalities where in rumex Allen mentions that cold air or cool surroundings cause an aggravation, lying down cause aggravation, and you see the remedy which is mentioned in bracket is hyoscyamus, and I was telling you about it in the initial part of the session. Amelioration from warmth, keeping mouth covered to exclude cold air. You have to compare this remedy with belladonna, causticum, drosera, hyoscyamus, phosphorus, sanguinaria and sulfur. So wherever you think of all these different remedies, think of rumex as well. So we come to an end. It is a very short session we kept today, but maybe we'll keep it with 2-3 remedies tomorrow to cover the Allen's keynotes, and we are almost on the session number 55 for Alan's keynotes. Those who are studying along, they have the benefit to understand all the different cases which I have shared with the uh, remedies that I have shared, the potencies, the repetition at sometimes, some other tips from my own experience, and something that I have read from the different sources. One of the interesting cases for rumex that I have had the experience to treat was a case of a female who was 3 4 months pregnant, and she was having extreme cough, and the cough, a similar cough, had caused miscarriage to this lady in the previous pregnancy. So this was a second chance. She already had a kid, and this was her second chance to conceive, but again the cough appeared, and it was a dry cough which was not abating, and I had already given few medicines which were not helping. So once I found this modality, which is aeration by cold air, I went on to prescribe rumex, and rumex 30 potency repeated 3 times a day for 3 4 days brought the cough down to 50%, and in a week's time twice a day dose reduced it to zero, and she could carry on her pregnancy further. So why rumex and why not the other remedies? That is a case for discussion in one of the sessions. Maybe after a month or a couple of months, I'll be doing a cough workshop. How you will understand the different coughs that are presented in your clinic. You can experience in the workshop how different categories of cough that I have categorized, and how you can see the different modalities, what type of cough, etc., etc. In that case is probably a part of that workshop. So that brings us to the end of today's session on Allen's keynotes, the remedy rumex, and tomorrow again the same time we will begin and take this study session forward. If anyone has any questions, please feel free to drop in the chat box or comment below.